Hi, this is Brian Kim. I'm going to share with you case number 54 in the best way to do cataract surgery series. This is somewhat of a dense lens with a medium pupil, and I'm going to show you double chop, cross chop, mechanical fracturing techniques using mechanical forces to crush the lens within the bag without using ultrasonic energy or high vacuum to prolapse the lens pieces up. And so I'm going to use a corneal marker to help me center and size my rhexis. And then using a cotton tip, I'm going to hold the eye steady and make my paracentesis incisions. I want to make sure I'm flat to the iris plane, which will allow me to have a nice corneal shelf, which will ultimately allow me to make a self-sealing corneal incision. I'm injecting some intracameral lidocaine and then some intracameral dispersive viscoelastic. I'm using the cannula to hold the eye. I'm going to make my triplanar corneal incision. I make a vertical groove. Place the blade into the deep part of the groove, tunnel through the cornea. I'm using the cannula to turn the eye away. Once I get to where I want to enter, I turn the cannula towards me and then enter. That's a triplanar corneal incision. So this is the puncture style Capsulorhexis. I'm going to puncture with the forceps and then pull downward, grabbing the right edge of the tear to create a flap. So I'm going to use the corneal marks, which will have helped me to center and size the rhexis here. Again, the pupil is a little bit borderline. We'll see how it stays during the remainder of the case. So I'm grabbing and re-grabbing, trying to stay within my corneal marks. And then I finish it off and then burp some viscoelastic. This is the Capsulorhexis hydrodissection technique. I place a cannula out to the contralateral equator, point the tip down, get a nice fluid wave, decompress on the left side. I'm separating the anterior capsule on the left side and then spinning the lens on the right side, pointing the tip downward. You can see this pupil has shrunk a little bit with that manipulation. So I'm irrigating the surface of the cornea, making sure the sleeve is appropriate. Lifting the incision with the chopper, go in with irrigation off to minimize Descemet's trauma. I'm going to start removing the surface epinuclear material. I'm going to place the chopper out underneath the anterior Capsulorhexis edge, out to the equator, turn the phaco tip vertically sub-incisionally, bringing both instruments together and crushing the lens in half. That's the double chop. Place the chopper out to the contralateral equator, crushing the right heminucleus in half, pulling it centrally towards the phaco tip. That's the cross chop. Using high vacuum to pull that first quadrant up out of the bag, and then placing the chopper around the lens piece, crushing it, and then emulsifying it. I do the same maneuver around the second quadrant, crushing it in half with the chopper against the phaco tip, and then pulling that last piece of the second quadrant up, crushing it. Using some vacuum now to lift the piece up out of the bag, using crushing forces, mechanical fracturing forces to sandwich the pieces together and emulsifying the lens piece. I'm turning the second heminucleus in front of me, placing the chopper around the lens piece, crushing it, pulling it centrally toward the phaco tip, and dividing the lens piece. Place the chopper around that third quadrant, pulling it centrally, crushing it and dividing it in half, and then emulsifying it. And this is the fourth quadrant, getting around the lens piece to the equator, pulling it centrally towards the phaco tip, crushing it and dividing it, and then pulling it up with high vacuum, again crushing it between the chopper and phaco tip, and then emulsifying the lens pieces. This is the final fragment. I place the chopper around the lens piece, sandwich the lens pieces. The reason I like to place that chopper around, it just makes it easier to pull the lens piece up, and it also makes sure that the epinucleus stays in place. I don't like it when the epinucleus comes up. I want to remove the epinucleus separately whenever I can. So now the epinucleus is coming up with high vacuum. I'm keeping the chopper deep to protect the posterior capsule. Take the chopper out, push BSS in, take the phaco tip out, and go in with the INA handpiece. I start subincisionally, grabbing the cortex from the anterior capsule side to try to peel it from the front to the back. Again, starting subincisionally, I'm peeling side to side, getting large sheets of cortex out. As long as you grab the anterior cortex and peel it from front to back, it just makes it a cleaner peel. Once all that's off, I switch to the polish mode and I'm polishing underneath the rhexis edge. You want to go to a lower vacuum setting because you can grab the capsule, and then if you grab the capsule, then you're grabbing and putting tension on the zonules. I'm polishing the posterior capsule surface now. You can see there's a lot of puckering of the posterior capsule, which does tell me that there's a little bit of zonular laxity with this eye. And I do tend to see this in denser lenses and or smaller pupils. You always have to be mindful that there could be some zonular laxity. And so because of that, I don't want to put too much trauma on the zonules, as well as when I'm aggressively doing the vacuum for INA, you want to be very careful. And switching to a polish mode like this is really very gentle on the capsule as well as the zonules. You can see I'm polishing in the subincisional area because there's some fine cortical material there, and I'm teasing off that cortical material from the posterior capsule, which will make it a little bit easier for me to get that subincisional cortical material out. In this case, I decide not to flush the subincisional capsular bag. I just go straight to the cohesive viscoelastic cannula, widen the incision with my diamond blade, and I'm going in with a 3-piece acrylic intraocular lens into the capsular bag. I turn the bevel to the left so that leading haptic comes out planar, making sure the leading haptic goes into the bag. Which I'm ensuring that it does with the Maltzman. Now advance the lens. As the optic is delivered, you turn the barrel 90 degrees counterclockwise. The optic comes out planar, and then you want to make sure that the trailing haptic comes out pointing to the right. Use a Maltzman now to dial in that trailing haptic. I just retracted the pupil edge with the Maltzman just to make sure I can see that edge. So I'm sure by retracting the pupil edge that both haptics are within the bag. I go in with the INA and then inflate the eye and then go underneath the optic, making sure I evacuate the bag of any viscoelastic. By doing it this way, I'm confident that both haptics are in the bag. So I switch to the viscoelastic mode, making sure all the viscoelastic is removed from the anterior chamber. I'm using the VSS cannula to flush into the angle, make sure there's no more viscoelastic, and then I'll hydrate my incision. So again, this is a moderately dense lens. I use double chop, cross chop mechanical fracturing techniques. All the movements are to place the chopper confidently around the lens at the level of the equator, making sure that you're within the bag when you do the maneuver, placing the phaco tip also into the deep part of the lens material so you can sandwich and crush the lens. That's why this is called the double chop maneuver. And then using cross chop by pulling the chopper against the phaco tip into the bag. And this is a very safe, gentle, capsule-friendly, zonule-friendly technique. You can see there's a clear cornea, and this was a very systematic and easy way to disassemble the lens. So I hope this was helpful to you, and I thank you for your attention.